Congenital diaphragmatic hernia is a fetal anomaly in which there is a gap or defect in the muscles that make up the sheet that separates the chest from the abdomen, known as diaphragm. As a consequence, some of the structures that are normally in the abdomen, such as stomach, intestines, and sometimes the liver, push through this gap into the chest. Because of these additional structures in the chest, the baby's heart is pushed to one side and the lungs may not develop as well. Most of these hernias are on the left, but they may also occur on the right side. What causes congenital diaphragmatic hernia? The cause is unknown in more than 80% of the cases, that is, isolated congenital diaphragmatic hernia. In less than 20% of the cases, the cause is problem with the baby's chromosome or genetic disorder. Here, the baby may have additional medical problems or organ deformities. In an isolated congenital diaphragmatic hernia, the primary concern is how much this affects the development of the lung, that is, the degree of the smallness of the lungs or the pulmonary hypoplasia caused by the defect. In order to determine if congenital diaphragmatic hernia is isolated and to provide the correct information about the disease, genetic testing is required. And this testing is very important as the genetic and chromosomal abnormality will have implication for the outlook of the baby. Now, what tests are done to find the reason for this abnormality? The only test that can be performed is called amniocentesis, which allows for the chromosomes of the baby to be determined. In most of the cases, the chromosomes will come back as normal, and this is important as it means everything can be done to help the baby when it is born. Now, how will the baby be managed? So, for the management of congenital diaphragmatic hernia, there are centers in the world where the treatment in the womb is possible. This procedure is known as Fetal, which is fetoscopic tracheal occlusion. The basis of this treatment is that baby's lung produce fluid that leaves the body through the baby's mouth. If this outflow of the fluid is blocked, it has nowhere else to go and as such swell up in the affected lung. As a result, the lung expand and its function appear to improve. This type of the blockage can be achieved by temporarily blocking the trachea with the balloon for a period of time. This is done through a keyhole surgery when a tube with a balloon is put down the windpipe of the baby and the balloon is blown up. The balloon is then deflated and removed with the tube at about 34 weeks of gestation. It is believed that Fetal works by increasing the lung maturation and reversing some of the damaging effects of congenital diaphragmatic hernia on the lung function. Now, what to do if Fetal is not available? In such case, the baby is monitored and delivered as planned. At the time of the delivery, every attempt is made to stop the baby from breathing on its own, as this will allow air to be swallowed in the stomach and stop the lungs from expanding. Surgery can then be planned close to the defect. So, a pediatric surgeon will closely see the patient and the baby and will decide how to close this defect. How much is the recurrence risk of congenital diaphragmatic hernia? The risk of the recurrence depends upon the associated genetic and chromosomal abnormalities. In case of isolated congenital diaphragmatic hernia, the recurrence risk is very low. How is baby delivered in congenital diaphragmatic hernia? This abnormality is not an indication for the cesarean section. A patient is offered cesarean section if it is indicated for obstetric reason. However, it is important that a patient delivers the baby in a unit where there are experts in managing the baby at the time of the delivery. As I explained earlier, the congenital diaphragmatic hernia is one of the fetal anomalies, and here we have a list of other fetal anomalies as well. We will explain all these anomalies one by one. Here you can see holoprosen cephali. Here is the hydrocephalus compared to the normal fetus. The spina bifida is shown here. Encephalocele, fetal cardiac anomalies, fetal renal anomalies, fetal congenital GIT anomalies at the time of GIT formation in the embryonic stage. And lastly, the Porter's syndrome, which is a combination of different anomalies in a fetus, including the renal anomalies, oligohydramnios, the facial defects, the pulmonary hypoplasia, and the limb deformities. Thank you so much. That was all about congenital diaphragmatic hernia and a little bit more about other anomalies as well. Subscribe on Obs and Gynae. Thank you so much. Allah Hafiz.